Hello everyone, welcome to Osteostrong Bakersfield. Today we're going to be going through some stretches. We're going to be doing some progressions here. If you're having any tightness in your lower back or you feel like you're having any tightness up and down your spine, these are some good stretches for you to do either before or after you're exercising, or you could even do it as a full session. So we're going to get started now. First one we're going to be doing is called a child's pose. So for anyone that's ever done any yoga or anything along those lines, you know a child's pose, just a very good inside groin stretch, hip flexor stretch. If you need to modify it in any way, feel free to modify it. But the first thing we're going to do is we're going to get our feet touching back there. We want the big toe on each side touching the other big toe. And then we're going to lean back and try to get a nice stretch in here in the hip flexors and in the groin area. And then you're going to try to take it back as far as you can. That feels comfortable, and hold for about 30 seconds. So it'll look like this. If that stretch is a little too much, or you feel like you can go with a little bit less of a stretch, feel free to go down to your elbows. But try your best to lean back and try to put as much pressure into your hip flexors and your inner groin as possible for that good stretch. Okay, once we've done that one approximately 3 times for about 30 seconds, the next one we can move into is called a pigeon pose. So this one's a little bit advanced, but if you can get into it and you have the flexibility to be able to get into the stretch, then it's a great stretch. Once again, for the hip flexors, really trying to open those hips up. If you open the hips up, a lot of times that will help the tightness in the lower back, and we can work from there. So, pigeon pose starts on all fours here. Then you're going to take your knee and you're going to try to get it to your opposite wrist. So this knee, left knee, is going to try to go to my right wrist. Excuse me, my left wrist. Your left knee is going to go to your left wrist. From there, you're going to take this hip and try to move your leg back as far as you can. That feels comfortable. And then from there, this left knee is going to move out towards the edge of the table as far as you can. That feels comfortable. So your left knee should be close to your left wrist, and your right leg should be as far back on the table as you can push it. That feels comfortable. You're going to try to get a stretch in both hips at the same time. The right hip, you should feel it, and the left hip, you should feel it as well. And you should feel it in the glute area. So this one, same thing. You're going to try your best to get down as far as you can. If you can get down to where your head touches the mat, even better. If you have to keep your elbows up here, even better. Or even if you have to come up here, whichever feels comfortable, whichever you can get into in the moment. Once again, this is another good hip stretch. So same thing, hold for about 30 seconds. For me, I'm able to get down to about right here right now. This feels comfortable for me. I feel a good stretch. I can hold it there. Doesn't feel like pain, doesn't feel like pinching, just feels like a nice stretch. At any time, if you feel any pinching, or you feel like there's pain, or you feel like it's very uncomfortable in the knee, or in the hip, or in the back, or anywhere involved, please feel free to stop. Come out of it, going to switch. Once again, right knee to the right wrist. Take it out as far to the side of the table as possible. Take that left leg back as far as you can. For me, I can get down here close to the mat. All right. So once those two are finished, we're going to flip over supine. And we're going to do some stretches on the back. Once again, trying to stretch those hip flexors out, trying to stretch that low back, glute area. That whole area combined is a lot of the places that a lot of times may lead to low back pain, or when we work on these areas, they can continue to take care of the problem. So we're going to go supine for these next one. And what we're going to do is a single knee to chest. So lean back as so. Get into a nice comfortable position, legs all the way out. And then you're just going to bring your knee into your chest. Grab it here. Hands are going to go here to the knee and pull it in as far as you can. That feels comfortable. Try your best to keep it right down the middle. Don't go out or in just yet. We have other stretches for that. We're going to take care of that in a minute. So for this one, you bring it straight in here. Should be feeling in your hip flexor area, a little bit in your glute, and you hold there for about 30 seconds. Once that's completed, you can switch sides, same thing. Try to keep the hands like this, locked, right on top of the kneecap. a modification. If you don't have the flexibility to be able to grab the other side of your knee like this and still keeping your head on the bed, another variation we could use is a strap. So lay down as you did in the beginning, and this strap is going to go underneath here. You can put it underneath the knee if that feels comfortable. You can put it underneath the hamstring if that feels comfortable. For me, I like to do it in the knee if I had to use this, and keep it with the same hand. So we're going on the left side. The strap is in my left hand, and you use the strap to pull in. Works just the same as the hand. Same thing on the other side. Strap goes underneath the knee. Goes in the right hand. All right. So now that we've done the single knee to chest, we'll do the double knee to chest. Same thing, head goes back here, straight down on the table, lift both knees and bring it in. You can use one hand on top of each knee and putting the feet together in the bottom, touch the ankles together, and pull back as far as you can. That feels comfortable, and hold for 30 seconds. Or you can, once again, clutch the hands together like this and kind of bear hug your own knees together like that. Hold for about 30 seconds, 3 times, and then come up. All right. So after that, the next one we're gonna do is another hip flexor stretch. This one's called the Faber stretch. Once again, we're gonna be in a supine position. We're gonna be back this way. Once again, head goes on the table, legs go out straight, knees come up one at a time, and you're gonna take your right ankle to the top of your left knee. So right ankle goes on top of the left knee, and then what you're gonna do is take your right hand to your right knee and push down that way. Put some pressure to go that way, diagonally away from your left knee. So what you're gonna do is just some soft overpressure with your hand. Go as far as feels comfortable till you feel a nice stretch there. Hold for about 30 seconds. Another variation you can do, once again, if you don't have a tremendously long arms or you'll feel like you're not getting enough push there, you can use a stick. You can use maybe a broomstick. In a lot of physical therapy offices, we use a wand, which is a stick with a tennis ball on top of it to be able to press down and give some overpressure there. But essentially what we want to do is we want to take that knee, place it on top of take that foot, place it on the knee, and then go down in that direction so that you feel a stretch right here in this area and on the inner groin. 30 seconds there, a couple times. Once again, left ankle goes on top of right knee, left hand goes to the left knee, and goes down there. Okay, now from this position, we're gonna do what we call a figure 4 stretch. So essentially the same setup. Right ankle goes on top of the left knee, right hand goes here. And what we're gonna do, instead of pushing down here, we've stretched going this way, now we wanna bring it this way to stretch the opposite way. So what you're gonna do is hands are gonna go in between this space right here, and you're gonna cusp the hands again, like you did with the single knee to chest, and you're gonna grab the knee and bring it in this way. Really nice deep hip stretch. If you can get all the way there while keeping your head on the table, even better. So that one right there, hold for about 30 seconds and let go. Same thing the other side. You're gonna take the left knee, left foot to the right knee. Keep this one down there as far as you can, that feels comfortable. Then the hands go through here, they cusp on the top of the knee, and lean back. You pull in as far as you can, that feels comfortable. Try your best to keep your head on the bed and pull in for about 30 seconds on that side as well. A variation we have on this one that we can use with the strap. Same thing with the strap. So we go back here like this, once again, set up, ankle on top of the knee, and you put the strap through this way. Strap either goes on the knee, underneath the knee there if that feels comfortable, or you can do a little bit lower on this one since we have some space there. Goes underneath the hamstring there. You can use either one hand or two hands and use the strap to pull in just like that. So if you don't necessarily have the flexibility yet to be able to grab your own knee with your hands, you can use the strap, no worries. Same thing on the side. Strap goes underneath here. Make sure.
Have a strap, would a belt work?
What's that?
If you don't have a strap, would a belt work?
Same thing.
Yeah.
Go in there, just like that. Use the strap. If you don't have a strap, a belt would work. Most people have belts. Most people don't have these just laying around. But if you happen to have a belt, that works just the same, or a rope, anything along those lines, just a long item that you can use to kind of grasp the knee and be able to pull it in as we're building up our flexibility. So those are some of the stretches we have for lower back. Check in for more later.